So, Joe, he was one of our Jiffy Knee patients from now 7 weeks out,
7 weeks tomorrow. Yeah.
and your right knee was a traditional knee done
4 months.
4 months ago. Both are doing well at this point. Some differences we did on that he had done on this side. He had this done by another surgeon. It's doing well. Some things were changed on our protocols after, as we generally don't do immediate physical therapy. Joe had gone the next day to physical therapy here. It was pretty painful, right, Joe?
Very, very much so.
Very
You're right. The
painful.
traveling is painful in the car and stuff. That the swelling is painful, and then after they do it, the subsequent day is very uncomfortable. And you find yourself just restricted to ice and elevation
Yeah.
because it's painful.
Mhm.
I found not going to PT I didn't go to PT at all with this one, but
Yeah.
not going initially was much better as far as recovery.
Yeah.
Just being able to stay up and ice it, and it seemed to loosen up on its own, as you worked it every day a little bit, and a
Right.
little bit, and
Yeah.
and I know how to work it because I had the PT on the other knee.
Yeah.
So
And you don't inflame it right away. They're in
right.
that heavy swelling
Mhm.
phase. So not all our patients make it through the end without any physical therapy, but some patients do. We usually decide after a couple of weeks how your progress is going and whether we initiate that or not. But he did it without that. The other difference on this side, he had no tourniquet during the surgery. Had a tourniquet on this on knee. What do you feel about the difference in that?
Huge difference as far as the back of my leg pain was probably there for a good 10 to 12 weeks.
Yeah.
And sitting on a chair like this would be real hard because it just ached all the time.
Eight dollars.
You
Yeah.
couldn't do it. And then the quad, of course, being cut, this was very swollen and tight,
Yeah.
and really harder to bend.
Hmm. And can you show us your range of motion? Straighten out and bend her back as far as she goes. So pretty effortlessly, he gets his knee bent to 130 degrees almost, I would say. So range of motion came back well. And if you had a choice in the future between the traditional knee and the Jiffy
It'd
knee,
be the Jiffy.
yep. Okay. Awesome.
Yeah.
One last thing he had is he had our new pain blocks after with something called Exparel, where we're blocking a lot of the geniculate nerves and all that. Um, he noticed when it wore off, it was day 3, right? That you noticed that
I thought I was doing it on day 2, and then
started to.
I mean, you feel real good after that day after
Yeah.
surgery. I thought, geez, this is going to be
Yeah.
great. Especially because this was a different surgery. I thought,
Right.
I'm going to have back up. I'm 4 weeks into recovery.
Yeah.
But
So
then after the block wore off, it was a painful day.
in the old days, the first 2 days after these surgeries were awful. So we're getting people through that with some new blocks we're using. And so that was successful. And how long did you take the narcotic pain pills after the surgery?
After that bad day, I stopped them.
Stopped. And so it was like 2 or 3 days after
2 or 3
surgery.
days, yeah.
Yeah. So great.
I may have taken one at night to sleep one night, but I don't think that would have been about it.
Awesome. Well, we appreciate you educating us and all the other patients out there
Well,
considering your
I
replacement. And
think you did a fine job, Dr. Lamoni, and
thank you.
I appreciate what you've done for me.
You're welcome. We appreciate you.
Great.
So, awesome. Okay.